Hi guys, welcome back to my channel. Let's talk about third year. If you're afraid that third year will change you, you're probably right. It's the part where you work, you endure, you lose parts of yourself before anyone else can see the glow up. You survive, you pass, and then you enter fourth year not knowing who you are without survival mode. So no, this video is not about how to study harder. It's about what breaks in you during third year and how you slowly build yourself back together afterwards. There are exciting firsts during the third year. You introduce yourself as the medical student to patients, you actually know something, you practice physical examination, you're touching medicine for real. But there's kind of a hidden trap in this. Even though you now have clinical practices, third year is still extremely theoretical. And these are the subjects people tend to fail, repeat years because of them, or quietly disappear from med school. Pathophysiology, pathology, pharmacology, just to name a few. This is where self awareness matters. Some people would make phenomenal doctors. They can act fast under pressure. They apply practical skills confidently. And they have a strong work ethic, good social skills. But what they struggle with is theoretical exams, the isolation before preparation for an exam, memorization heavy systems, exam stress, and abstract concepts. They are the people who often either don't even get into medical school or they end up dropping out. So you must know your weaknesses and act accordingly. If you're very practical, confident, and hands on, you still have to prioritize theoretical subjects. This means prioritizing studying over perfect lecture or practice attendance, or making studying more practical for yourself. You can watch videos instead of relying purely on books, or even implement active recall sessions during some of your already existing practical routines, like a monotone cardio session or house chores. This ties directly to my Studying 101 video. For many people, third year becomes monk mode. When I was in third year, this was a trending phenomenon on social media. The idea of withdrawing from society to focus fully on your mission and then re enter life as a better version of yourself. If this is your season two, like it was for me, I recommend you only consume content that aligns with this phase of your life. Avoid anything that can trigger FOMO, the fear of missing out. I'd avoid checking socials, Instagram, where you can see your non medical friends traveling on holiday, skiing, or doing the absolute most you're definitely not going to be doing this year. This will only disturb your inner peace, so save yourself the heartbreak. Those things can wait. And you can go absolutely feral in the summer after you pass exams. Building big things in life are always a long time commitment and a long process. And during most of the journey, there will be little to no rewards. Think about even making a YouTube channel, for example. It takes years before you get acknowledgement or return out of it. It's the same way with med school. Third year is the actual gatekeeping year between I am almost a doctor and I just got into med school, but it's not sure that I'm gonna finish it too. Or modern life glorifies fast success, and we think that we should have already achieved things by the time we're in our 20s. But the truth is that no generation achieved real success without periods of intense work, without any reward or return. My next point regards to pathology and dissection practice. We want this to be a gradual exposure therapy that creates a safe environment to learn new things instead of trauma that keeps you up at night. If you hate autopsies or dissections, that does not mean you're not cut out to be a doctor. Always keep in mind what you are and what you are not required to do in this particular subject to pass the exam. For example, in my practical pathological exam, I was required to examine the organ, find pathological signs, measure, describe, and present findings properly. What you are not required to do is stare at bodies unnecessarily or expose yourself to distressing things that add a zero exam value. Unnecessary exposure to things that harm you mentally makes absolutely no sense. I always did exactly what I was required to do and nothing more. Even if your practice leader insists on bodies being cut open in front of you, you are not legally obliged to watch or listen. Just save yourself the trauma. I have heard adults recall their own traumatic experiences. You could just tell that was trauma, that was not learning. I still think that it's unnecessary. Just because it was traumatic for those adults doesn't mean that it has to be that for you. Create a safe environment for yourself. If you know that you don't want to look at a particular thing, this could be like a hand or a feet or whatever, you don't have to. Find anything that's next to it and look at that. Like, I would look at my groupmate's hair, or I would look at gloves on the side, anything, to be honest. And guess what? My pathology practical exam, it was great. I got the best grade. Why? Because I learned the material and I did exactly what I was required to do. I described the pathological signs on the exam. I didn't have unnecessarily trauma distract me from it. Most doctors will never perform autopsies in their careers. The only specialties in my country who have to see dead bodies are family medicine practitioners when they go for a house visit, pathologists, and forensics medicine physicians. The people of your country desperately need compassionate doctors in every field of medicine, not just pathology or forensics. So, panicking in advance or questioning your entire calling because of this is unfair to yourself. My next point is how I think you should make the most of your clinical rotation and what to use them for. Clinical practices doesn't mean you have to know everything in every field of medicine. So I would apply gradual exposure. You are there to learn a new skill, like how to perform a rectal digital exam. You are not there to be traumatized and absorb all the drama that's going on in that ward. I just give you like a quick example. If a patient dies during your clinical practice, you're not required to be there to hold their hand or even examine them. Gradual exposure and trying new things are good. Notice how they make you feel. Or what are some things that you think, wow, I don't want to deal with this in my specialty? Three areas I would pay attention to in a clinical practice. One thing is how much I like these things that I have to do here. The practical things like endoscopy or other hands-on exams. I like what kind of patients or what kind of diseases I'm going to be dealing with. The second thing would be is to focus on what you will be required on the exam to do, just like we talked about during autopsies. Third thing would be to observe people working there. Pay attention to how they talk about their own field of medicine. Observe how residents look. Do they look 10, 15 years older than their age? Notice how they treat it. Do they have to run the whole ward by themselves while specialists disappear into their offices? And maybe even have conversations with residents because they will be quick to tell you if they have to do extreme overtime or if they're considering leaving this field. Trust me, I don't usually start conversations with strangers or people I just met, but I've still had instances where I was on a clinical practice somewhere and the residents would straight up tell me to never come here and they want to get out of here. I know this sounds bad, but I'm just saying, having conversations, you can learn a lot. The thing that drew me to my own specialty wasn't prestige, it was how healthy and balanced the residents looked. I saw a life I wanted and I took the steps to get there. We'll talk about how to secure positions in a future video. Up next, I wanted to talk about how it's completely normal to not feel ready to be a doctor yet. Not feeling ready, not feeling passionate, or not knowing any specialty you could tolerate is normal at this phase. Oversaturation kills interest. So, if medicine takes up 95% of your life, of course you'll crave everything else. That doesn't mean you're not cut out for this. For the longest time, I didn't feel drawn to any specialty, and I could only see things that I did not want to do in those fields. And this is completely normal. What I love about my job now are all the things that I could not see back then as a student. I like the chase. I like the thrill of finding out what's wrong with my patient. It's like a mini detective work. I like the thrill of performing a small surgical procedure on my own for the first time. Of course, I'm young and I'm only learning, but I like that I have these small moments of achievement in my day and small things that I can celebrate at the end of the day. And I also appreciated the feeling when I felt I provided good care for a patient and the patient was grateful and I felt good about doing my job well. These are all things that I never thought I would feel when I was in third or fourth year. So it's okay if you don't feel anything like this yet. My next point is about physical recovery after third year. Recovery starts the moment exams end. Treat it like you've never stopped. Gym, Pilates, walking, movement. Do not wait to look good to start. Going to the gym while you're uncomfortable in your body is a skill, and it's much easier to master than med school. If it took a lot out of you to pass exams in third year, might have gained weight. And when you see your relatives in the summer, they make comments about how your body changed and you can feel like it's unfair, it hurts. You might not look how you want to this summer, but you need to accept that. Change takes time. I had to buy baggy clothes after I passed third year, but I showed up anyway. And 5, 6 months later, the results already started to show. Don't even think about how your body doesn't look or feel how it did before third year. Don't let it stop you from doing what you need to do now. And don't let it stop you from living your best life. And repetition will not only make you better, but this will be your new normal. Going to the gym while not loving how you look, you would feel that it's normal and you won't question it every single time. And before you know, the results will come in. And of course, as always, I left the most important point to the end. And this is when all is said and done. You pass third year exams. And now you have to face what's on the other side. This point is about the identity loss after surviving third year. When you finish third year and you start fourth year, suddenly the pressure drops a little. You would expect to feel happy, relieved, free even. But instead, many people feel strangely empty. And if that's you, I want you to know this. This is normal. After third year, I didn't immediately feel like myself again. I didn't feel motivated. I didn't feel passionate. I didn't even really know what I wanted. And that scared me because for years I knew exactly what to do: study, push, survive, and repeat. For a long time, your identity has been reduced to one thing: endurance. Your nervous system learned, I am someone who survives pressure. So when survival mode ends, your brain doesn't automatically know how to rest or who you are without urgency. This creates what I call an identity gap. You're no longer in crises, but you're not fully alive yet either. A lot of students misinterpret this as I lost motivation. Maybe I don't like medicine. I burnt out. When in reality, their body is just relearning safety. What not to do in this phase? When the emptiness shows up, many people panic and unconsciously try to recreate stress. They overload themselves again, start unnecessarily projects, rush into big life decisions, or shame themselves for not being productive enough. Because stress feels familiar, structure feels safe. But forcing purpose too early delays recovery. You don't need to immediately know who you are now. You need to let your nervous system settle first. Recovery is not laziness, it's active reconditioning. You're teaching your body and brain again that rest doesn't equal danger, that your worth is not tied to pressure, and that pleasure doesn't have to be earned. That's why physical recovery matters so much in this phase. Not to fix how you look, but because sleep, movement, and food are the fastest way to calm identity panic. When your body feels safer, your mind will follow. Hobbies and side quests also matter, but not in a way that you think. You know, when people give advice, just get a hobby, but that's incomplete advice. Starting new hobbies after third year are not about being good at something, not about building a new identity overnight, or not about being productive again. They are about something much smaller and much more important. They are about remembering what it feels like to want something without pressure. Good side quests in this phase are dance classes, especially the ones that focus on reconnecting with your feminine side, sports with no metrics, just running and vibing for your own music, creative work, or group activities with no performances. The goal is curiosity without stakes. That's how sense of self starts to come back quietly. Rebuilding an identity comes in layers. If you try to jump to who do I want to become, you will feel lost. Instead of focus on recovery in layers. First, the body. Focus on regular sleep, regular eat and movement. The second is the nervous system. Reduce urgency, allow boredom, and normalize rest. Only then can you step into the next layer, which is the self. Notice what you're drawn to without forcing meaning. And only then comes direction, specialties, goals, relationships, new side projects, research. Most people try to start at the last step and feel behind. But I want to warn you that if you skip this phase, it doesn't disappear. It comes back later during residency, burnout, or a breakdown. Fourth year is actually the safest place to do this work because you finally have just enough space. So don't rush to define yourself again. Let yourself exist without pressure first. Clarity follows calm, never the other way around. And once you start feeling like yourself again, that's when decisions about dating direction can come from a grounded place instead of survival. As a bonus topic, I wanted to talk about something more juicy. After giving yourself time to recover either physically or facing your identity crisis, we'll finally have the opportunity to do things that regular people do. So, I wanted to talk about dating during med school. A supportive, committed relationship can be a secret weapon, but on the other hand, unstable partners can destroy years of work. I've seen people fail exams because of breakups that happen during exam period. Please don't date emotionally unsafe people. Always look at how they handled past breakups and avoid partners who resent your ambition. After third year, fourth year can be a safer space to explore dating consciously and strategically. If you want me to make a separate video about dating in med school, let me know in the comments. If you're in your third year right now and this video felt a little too close, that's because you're in the middle of a transformation. Nothing about this phase is supposed to feel impressive or look aesthetic. It's supposed to feel unfinished. You're not behind your potential. You're becoming someone who can hold responsibility, uncertainty, and real people. And that process is uncomfortable by design. If this video helped you to feel a little more understood, or made you take a breath you didn't know you were holding, I'd love to know. You can like this video so that it reaches more people who need to hear it, or share it with a friend who's struggling. And if you want more honest med school content about choosing your specialty, dating, or going on exchange practices, you can subscribe. I'll see you in the next one.